Thank you so much for the kind introduction, and thanks to the scientific committee for the kind invitation. It's really an honor to be here today. And actually in this talk, I will be talking about two subjects that I would call my personal passion, AI and surgical education. And I will try to show that how we can use AI to improve surgical education. I would disclose that I'm a director of research and skill development at Orsi Academy, which is the dedicated robotic training center in Belgium. I do act also as a consultant at the advisory board for several medtech companies, but it's unrelated to this talk, and I have no financial conflict of interest. I will start to briefly introduce the surgical education concept. I'm sure that all of you are familiar with, but just to step back and pause on what we call surgical education and where we have to actually put our effort for development. And then I will discuss it in several domains that we can use AI. I think we all would agree that learning surgical skill is considered as a complex skill acquisition. We need a set of a skill to be able to perform surgery. And those set of skills are cognitive skill, which is the knowledge that we do have. It's psychomotor skill, which most of us know surgical training as training of the psychomotor skill, but of course it's more beyond that. And then we have some non-technical skills, which are basically leadership and this kind of skills, communication that we need. It's important to know when we are talking about the cognitive skill in surgery, we are actually discussing the higher level of taxonomy for cognitive skills, which is evaluation and creation. And that needs to be trained, and you cannot just earn that knowledge by reading books. So we know that the surgical training today is very different from the past that we or our past generation learned surgery. We know there are a lot of, unfortunately, possibility for the error in the OR that are unforgivable. The surgical safety concerns are much more important nowadays, and there is, for these reasons, there is the decrease in autonomy of the surgical residents. And because of all the complexity that we add to our surgical practice, like robotic platform, laparoscopy, and advanced skills that we need to learn, this makes it a complete sense for total chaos that we cannot anymore actually, based on the previous method, train our residents. So we need to move to another way, and we need to look at the surgical training from another angle to be able to go forward with the speed of the technology. So for cognitive training, I will try to give some example of how we can use AI and modern technology for training. I think we all have been, as a HPB surgeon, are very much familiar with 3D modeling because we use it not only for surgical training, but also several institutions are using the 3D modeling for standard practice for preoperative planning. But we still have most of our images in the medical field in 2D models, CT scan and MRI. We can reconstruct them in 3D, but it would be very nice if we can see that 3D in a 3D model, which is a virtual reality environment, and eventually superimpose it during the surgery on the human body, which will be the augmented reality. So before we start with the teaching somebody, we first have to know what we need to teach. And for that, we need a curriculum to add as a basement of our teaching methodology. So we have developed a curriculum for general surgery residency. That's only for general surgery residents. For HPB surgery, means that those general surgery residents who come to our department for a training, we do have a curriculum for them to what kind of skills they do need to learn. And based on that, we have developed some interactive e-learning model that before they start a rotation, they have to go through that model. And then they get training based on the using the Fuji medical system that we do have in our department as a standard for preoperative planning. We train our residents how to use that, and we train the liver anatomy on this 3D platform. And then we basically have them to go through this curriculum, which is start with the baseline assessment, e-learning, and then they get their training on the 3D model. And then we assess them, and we actually put this second stage of training using the virtual reality environment that we have developed. It's a multi-user environment. The trainees are in the same environment that they can see the same thing. They can discuss it together with the trainer. And we use this for surgical preoperative planning. And of course, in the age of our resident nowadays, they are very much fan of this kind of interactive learning. And we have done a randomized trial also that shows this is effective comparing to the previous methods. And now we have also developed a long model for thoracic surgery training as well. But let's think about how we can train the most difficult thing to train, which is the teamwork training, the non-technical skills that still, I believe, it's very much missing in our curricula for training. The concept of OR black box was introduced about almost 10 years ago at the University of Toronto. Now, for research purposes, we have it installed in one of our operating rooms. It's a hybrid operating room for thoracovascular surgery. And what we do with the OR black box, basically we record everything in the OR, which includes from the camera in the that records the environment, the endoscopic view, and also the sounds of everyone that is, there are several microphones placed in the OR. And exactly as the concept of OR used in the airplane, we are using the same concept for research purposes in terms of teamwork training. And it's very important now that we also have this regularly being recorded. Basically, we, for every resident who does the surgery as a first surgeon in that operating room, they always get a video review feedback of their performance. They select which performance they would like to get feedback on it. And we go through the performance of them during the surgery, and not only how technically good they performed the surgery, but how they communicated with the nurse, with the patient, with the instrumentist. And that's also something to learn from. And there is quite a large body of evidence nowadays that shows this can be effective. But of course, it needs a lot of cultural work before we have the OR black box installed in all of our operating rooms. Then the most important one is a psychomotor training, of course, that we consider all. I'm sure all the robotic surgeons in the room have already practiced this type of virtual reality simulator, which is the very first beginning of the practicing robotic surgery. Before, this technology exists for many years now, but in the time of laparoscopy, we were not very much fan of it because we were very much attached to the haptic feedback that we get. But now that the robotic surgery took away that haptic feedback, we get to start our training with this simulator, and it shows to be also effective. But I want to focus on some more, well, I think tomorrow in terms of psychomotor training, I will have more detailed talk about how to teach robotic surgery. But what I want to focus on today on it, how we can use AI to help surgical training and specifically robotic training. So it's important to know AI can support support the surgical training in two main ways. One is assessment and one is training. AI-based assessment is relatively straightforward, I would call it. We can analyze the surgical videos with AI. We can take out some motion data and detect velocity, this kind of metrics that exist, and the computer can recognize that. And then we can process the surgical flow. I will show you examples of how can we do it. Of course, it's not very easy, but it's very much doable with some technologies that are accessible today. But what is very difficult is AI-based training, because AI-based training just doesn't look at your performance. AI-based training look at your performance, understand what's going wrong, make a logic out of it, and communicate it in a term of feedback with you. And that's something that it probably will take years to get there, to have that AI-based training. This is an example of the surgical practice that we do at Orsi Academy. It's a basic model, chicken model that we use for teaching the basic skills, which here is the anastomosis skill. The very first training exercise that the robotic naive surgeons get. And we do have a curriculum developed for the basic skill training to define those errors here. And I can show you, this is the score sheet that we are using to score the trainee when they are performing this procedure. And you can see we have defined, validated this, and we use this as a metrics for proficiency. And with all the details that you can see here, we score them until they reach the benchmark proficiency. So what we are doing actually in Orsi, we spend a lot of time on kind of automating this score system. And this is, I would say, quite successful in doing it, because, for example, this is an example of it. We score if the needle is out of view and loaded on the instrument as an error, and you can see for the computer it's very easy to recognize this needle is out of view and score it. And for this, you probably can in future delegate this to AI instead of having a trainer sitting there and scoring every time that this error happens. This is a bit of a more complex error, but still computer can do it. We call it incomplete or repeated bite, when you are approaching to the tissue with your needle, but you are failing to pass it. This is also, if you think about it as a human, maybe it's very difficult for us to look at it in an hour that the trainee is practicing, but for computer this is not very difficult. It can be very objectively scored. And these are the tasks that actually, hopefully in future, we can have AI helping us with that. But of course, the real surgical procedures are way more complex than just an anastomosis task. And we hope that AI brings us some opportunity that we can analyze a huge amount of data and there also make meaningful information. So this is a very simple and very routine task that AI can do, the recognition of the surgical phase as the procedure is the hepatectomy is going on, and you can see that the computer can predict that what kind of procedure the surgeon is doing. This is only about the act, it's not about the quality of the act, and it's not giving any feedback. And it's not without challenges, because of course the surgical video is very long and it's very difficult to understand it. We can go also further and we can analyze it just as I showed in the chicken model, the tool and tissue interaction, and realize that if the surgeon is performing according to the actually the standard that we as a surgeon would like to see. And this is also possible to recognize in the surgical videos. But of course, having all of this doesn't bring us to the AI-based surgical training, because for AI-based surgical training, we constantly have to balance two critical domains. We have to have our expertise in what we are seeing, and we have to have the ability to interpret that and communicate that in a language that can be understandable for the trainee. And this is something that still needs a lot of work to do to reach that. Vision language models can potentially bridge this gap. I will a bit say it with some hesitation, because I believe there is still a long way to go to have an AI-based training available. But what we would expect from the vision language model is that to have two different blocks. I can show you here as an example that there is an image that you can show to the computer, and a vision encoder can understand that vision, and then we ask a question, and then there is a language encoder that can translate that, and eventually this two information goes to something, imagine as a ChatGPT, and you can get a logic answer. So here there is an image of the castle. The question is that where is this castle located? And eventually as an output we can get an answer that this castle is located in Ghent. So this is an example of what we are envisioning as a building block for having an AI-based training. Of course, this is not very much of a future concept. We are still now working on it, and there is some improvement in that happens. Now we have a vision language model that can look at the surgical video, that can understand what is happening, and this is the setup that you can see. We call it surgical co-pilot, as I think in Ghent we like a lot airplanes, so everything is about the pilot. We try to mimic what they are doing, and we hope in future we can use this surgical co-pilot as in the first sense for training the younger generation, that during the surgery they can communicate with the surgical co-pilot and understand what is going on, and hopefully in future as an intraoperative guidance for the surgeon. So I think if we want to look into the future, I think AI in surgical education holds a lot of promises, and we can enhance the education in cognitive knowledge and affective and psychomotor skills. Automated assessment is very near to reach, and we can do that, I think, hopefully in a very near future, and have a lot of load of assessment being done by AI. But AI-based training is still a long way to go, and I think we need to invest a lot of research on that before we get there. And I think in future, with the continuous development of the robotic surgery and machine learning algorithms, we can hopefully see the surgical expertise objectively assess that and anticipate the surgical outcome. Of course, I would like to end this talk because I am very much fascinated by all the AI research and simulation training that we are doing. But as this AI-driven training is going further, we should make sure that we don't basically replace the human mentors with algorithms. The human still needs to stay in the loop. And of course, we should not forget about the accessibility and equal training opportunities in future. But I believe with the technology, we probably could be able to a bit narrow those gaps that nowadays exist. If you are interested in surgical AI, our Surgical AI Congress this year again is organized in February in Ghent, and we would like to welcome all of you who have interest in surgical AI development. And I'm happy to answer any question.